There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question, what is reactive hypertension? How can it be prevented? Answer by Maxwell Chan, chronic insomnia specialist. Many people react when their blood pressure is being checked, and it almost always makes the blood pressure higher. It sometimes can be very difficult to know whether the blood pressure is really elevated or whether it is reactive hypertension, also called white coat hypertension. Refer, SoulToday.com, the #1 St. Louis website. By convention medicine, as a primary care doctor, I often have to decide whether the elevations in blood pressure are reactive to the situation, so I routinely recommend checking the blood pressure at home several times weekly between visits. There are automated blood pressure devices you wear for 24 hours, which track either blood pressure every 15 minutes or so. Many people react poorly initially but, after a few hours, don't even notice when the device inflates. Occasionally I have to resort to looking for signs of damage to the heart or blood vessels of the eye to determine whether the reactive blood pressure needs to be treated. By complementary and integrated medicine, some people, like me, believe it may concern the people's digestion systems sensitive to environment. This topic is still under researching yet. However, answer may be already in this book. Naturally have your high blood pressure controlled. Functional Food Therapeutic Lifestyle Changes Intervention Program. Answer by Rick Brown. Reactive hypertension is a misnomer. It is used to refer to elevated blood pressure caused by a stimulus. An example would be white coat syndrome, in which some people's blood pressure becomes elevated when at a doctor's office or medical clinic due to fear of needles or other apprehensions. Hypertension is not synonymous with elevated blood pressure. Certainly, anyone with untreated hypertension will have elevated blood pressure, but a temporary elevation in blood pressure due to a stressful situation, e.g., white coat syndrome, is not the same as hypertension.